Hello, everyone. Welcome back to another episode of Einstein's Eyes, where we delve into the rich, intricate world of ophthalmology and healthcare. So I'm Carl Rosen, oculoplastics, neuro-ophthalmology, Anchorage, Alaska. I have my friend and former co-resident from Einstein, Jon Ditkoff. Jon.
Hi, everyone. I'm Jon Ditkoff. I've been in practice for 30 years as of this week in northern New Jersey. I do general ophthalmology, specializing in cornea and dry eye and laser vision correction. Carl and I met 35 years ago at Albert Einstein, where we did our residency, hence Einstein's Eyes. And I'm very excited for the topic tonight.
Right. Thank you, Jon. But today we have a very special guest, Joe Caiazzo. Joe is a renowned political consultant and the founder of the JCN Group. And a fun fact, so Joe and I were classmates. We became friends at the Harvard Kennedy School. I don't know if you can see that, where I took a sabbatical. I really needed to get my head examined for doing that. My wife freaked out. My partners freaked out, but I did it. And Joe was one of the good guys, super smart, politically connected. I'll let Joe give his background, his bio, but I do remember, I'll never forget, Joe worked or was a campaign manager or staffer for Bernie Sanders, right?
Yeah, so I was a staffer for Bernie in several states in the 2016 and 2020 presidential.
Good. So Joe, tell us about yourself and, maybe make some comments on what the amazing events that happened today. And then we'll talk about your engagement with healthcare.
Sure.
Go ahead.
So Joe Caiazzo, it is absolutely great to be here with you both and all of you viewers. I'm coming to you live from Danvers, Massachusetts. Danvers is a small town that is right next to Salem. Small fact, Danvers is actually home to the Salem witch trials. Back in the late 1600s, Salem Village was actually the original homestead of those who were accused of witchcraft. Fast forward in time, it changed its name to Salem. It changed its name to Danvers. So that is my little fun fact of the day here. I am I'm a partner at the JCN Group. We're a Boston-based public affairs firm, and we basically do lobbying and government affairs. We do campaigns on the corporate and political side, and we do a lot of strategic comms work, whether that is pitching your story, speaking to the press on your behalf, things of that nature. Before beginning business, I spent about a dozen years on the campaign trail. I worked at campaigns at all levels, starting off at your down ticket races for like mayor and city council and things of that nature. Then over time, I went up the food chain and I worked on several races for the U.S. Senate, and, for folks like Elizabeth Warren, Sheldon Whitehouse, and Joe Kennedy. And I worked on several races for the presidency for people like Bernie Sanders and Hillary Clinton.
Great. I got a fun fact. Jon you're a councilman, right, Jon?
Yeah, I've been a councilman for 14 years in my town in northern New Jersey, Upper South.
Great.
And I've been mayor, and I'm now the council president.
All politics are local.
Yeah, exactly. Well, I like local politics. As you know, we actually get things done here.
Yes.
It's really a big difference. You go to a meeting, you say we should do this, and then 3 months later we're doing it, as opposed to national is much more difficult. Federal.
Look, working families depend on things like trash removal, snow removal, schools being properly funded, stop signs being put in, crosswalks being, properly cared for. These are things that help people's lives, the quality of people's lives, day in and day out. The part that's great about it is there's not much that is controversial about making sure that your kid's school is properly funded or that the snow plows come down the street when it snows out.
Right.
Yeah, 100%. So that's in Anchorage, that's particularly important, getting the snow.
Right. Sure.
And right, that's so important. Just keeping the town safe too, so you can go out at night and have a meal with your wife or some friends. So Joe, I wanted to hear your take on the events today, really historic, monumental events. have, my guess is, a massive impact on healthcare policy and how, the government looks at some healthcare issues. Just give us
No, let-
your feeling.
Sure, sure, sure. So let's start here. Every 4 years, we elect a president or we re-elect a president. We also elect a third of the U.S. Senate, and we also go and elect or, go and re-elect all 435 members of the House of Representatives. There's a lot at stake at this election for several reasons, right? And let's start with President Biden. President Biden, I am convinced, will go down as one of the most historically accomplished presidents of our lifetime, whether it's making 17 million jobs, keeping, record low unemployment, fighting to combat the perils of inflation. And, abroad, Joe Biden has worked extraordinarily hard to go and maintain the integrity of NATO and to stand up to fascist dictators like Putin. Look, I think that he ultimately is. I think the two best words to go and describe Joe Biden is selfless patriot, and his decision to exit the race today, I think, stems from his selfless patriotism, which I think, we can all find extraordinarily, admirable. There hasn't been anybody since Washington who's been able to walk away from this type of power. In terms of how this goes and relates to healthcare, look, the balance of the U.S. Senate depends on the outcome of this upcoming race. Right now, the Democrats have a majority, but it is not large. There are several Democratic members of the U.S. Senate who are running for re-election in deeply Republican states, people like Sherrod Brown and people like Jon Tester. It's incredibly important for Democrats to win the Senate, or at least to hold on to it, because then they'll be able to maintain gavels. And, by going and maintaining gavels, you are in charge of which pieces of legislation are coming to the floor. And if you look across the building over to the House of Representatives side, I think the Republicans, if the Republicans lead the Democrats by about 9 seats in the House, that is tight. It is a tight race. There are several members of the Republican Party in both the House and the Senate, for lack of a better term, who do not follow the science, right? And it's not even a matter of going and disputing best techniques, but it's going and disputing hard science. And I think when it comes to healthcare policy, and when it comes to economics, and you can't separate economics from healthcare, right? Especially in this, in the way that we pay for our healthcare. I think it's really important to have people in control of the flow of legislation and in control of both chambers who actually do believe in putting all the facts on the table and trying to solve our problems that way. Because look, people across this country are seeing their medical bills go up every year. They're seeing their prescription drugs go up every year. And for the last decade, 2 decades, the increase in that has outpaced what their take-home pay is. So at the end of the day, I think we all want to work towards a society where everyone has the access to the quality healthcare that they need. I think the way that we get there, folks have different, there are several different paths to get there. But I think the ultimate goal we all share, the goal of getting people access to quality healthcare.
Right. It's interesting. We just received a letter from the American Academy of Ophthalmology, John, this, where they wanted to reduce reimbursement by 2.8%, another 2.8%. So this happens every year. They ratchet down Medicare reimbursement to physicians, ophthalmologists in particular, since that's my space and John's space. And then the Congress just kicks the can down the road because they somehow always manage to find the funds to erase that, or at least to mitigate that. What's the strategy there?
One thing I would add to that, though, is what is incredible, and you could speak to any physician or patient about that and say, what other industry right now is not getting a raise? I mean, physicians are happy when they barely get a reduction or no reduction. But that's been going on for so many years. When you look at inflation and what the average medical practice is paying their staff and paying for their health insurance and paying for the cost of computers and all the other things you need to run a business, the prices are going up for everything, but our reimbursements are either frozen or going down. And that's a problem. And I think it's bipartisan. I think at this point, Republicans and Democrats, they just don't want to think about these. And a lot of the money, unfortunately, I mean, I'm very curious what you think. A lot of the money that you see the healthcare costs going up and up and up are not going to physicians anymore. They're going to private equity. They're going to all these other layers, the pharmaceutical industry. That's where all the money's going. So ultimately, what you're going to have is physicians that don't want to stay in medicine, and that's what's already happened.
Yeah, look, there was a front page story in the Boston Globe maybe a month ago now, and it basically walked through how there is a primary care physician shortage.
Yeah.
And, the numbers were staggering. Basically, what they did was they went and laid out the number of primary care, the whole number of PCPs next to the number of specialists, next to the number of people who need care. And I mean, the number is eye-popping on how few doctors there actually are and what they're expected to actually do. And the piece dove fairly deeply into why that is, and it went and outlined essentially compensation. Not that it's all about the money, but look, there is a thing of the dignity of work, right? And if someone's going to work a 50-hour week and they're under the pressure of company X, as opposed to working a 70-hour week and you've got to see 200 patients, it completely makes sense why people can get burnt out and go and leave the industry.
Right. And
I do think.
Yeah.
Sorry,
go ahead, Joe. Sorry.
Look, I think that we're at this really fascinating time in our history. It basically took this country 60 years from the point of learning to fly to put a man on the moon. That is a relatively short period of time for such an amazing feat. I think the problems that we face now, we have the answers to, right? We have all the ingredients on the table. Now we've got to put them into the bowl in the right, in the right order. I'm confident that we can do it, but I think there's one major element that is missing. We need political will, strong, political will. And if you look back at people like Johnson, you look at Kennedy, you look at FDR, you look at Reagan, incredibly bold leadership is required to get these big, things done. And we saw this with Biden, right? But he had to spend his time and energy on the economy, right now, especially on the heels of COVID. When it came to President Obama, he devoted a lot of time and energy to the Affordable Care Act, which became an incredibly partisan battle to this day, right? And I feel like our politics have basically served to put our politicians in a place where, the political will basically takes priority over the will to do what's right, or the ability to do what's right.
Right. So, Joe, I mean, as a political consultant, how do you build effective coalitions? How do you communicate? How do you just advocate for, either grassroots or grass top engagement with the public?
Let me start here. Fundamentally, I believe that people feel politics long before they think about politics. Here's what I mean by that. When I say to you, George Washington, George Bush, Donald Trump, Hillary Clinton, before you think of a single policy, you feel in your, body, do I like that person? Do I dislike that person? Do I want to be like them? Do I not want to be like them? People feel this. And I think that thinking about our public policy, thinking about our politics has to come from a place of feeling, which can sound a little crazy, but if you think about the fundamentals of it, like in 2016, when Bernie Sanders would say, nobody who works a 40-hour week should live in poverty. You feel that because it makes incredible sense. Then it makes you question, wait. There are people in this country who work a 40-hour week who live in poverty, right? So, speaking to people on their own terms and going at it through the lens of people feel this long before they think about it. We had a project for Children's Hospital of Boston a couple of years ago, and they were going and expanding. Children's Hospital is located in the Longwood area of Boston, which is, basically downtown. It's very, very busy. And they were trying to put several different satellite offices all along Route 128, which essentially circumvents Boston. So, you know, the way the state law is written is that, you know, if a healthcare provider wants to do that, they have to go to the local town or city. And they have to get like the approval of the State Department of Public Health. The way that works is you have to build a coalition of people who live within a radius of where that, you know, certain thing will be. And they go and offer testimony to the Department of Public Health about why this would be beneficial or not beneficial, you know, like to those like cities. That was probably the easiest, most fulfilling project I had ever had, because everybody from the Boys and Girls Club to mayors and city councilors to everybody in the middle had nothing but positive experience from there. So the feeling in this whole act to go and, you know, right. So we had to go and organize 4 or 5 different cities. It was so incredibly easy to organize them because the feeling was overwhelmingly positive, either through people's own story or friends of friends or things of that nature. So when it came time to offer testimony to the DPH about why this is a good idea, this was a no-brainer. It was so incredibly easy because nobody spoke about figures or facts or like, you know, this is this case study. It's all a personal story about my child or me or my neighbor's child. And the whole thing of like people feel politics before they think about it, I think goes and resonates across the board.
So you're saying, so you use storytelling to engage.
It's incredibly important. Look, I could sit here and talk about how, you know, the White House made 17 million jobs over the last, you know, certain number of years, but it's far more effective if, you know, we went and brought on a bunch of guests who talk about how they lost their job during COVID, or people who graduated college on the heels of COVID, or someone who started a business and have been able to go and grow that business over the last 4 years, because you put faces to these stats, you put names to these stats. People are more than just a number. And I think voters understand that. And I feel like voters feel that, even if it is subconscious.
Right. So just for our audience, I just want to explain the difference between grassroots and grass tops. So grassroots advocacy involves engaging the community, engaging people on the ground. That's grassroots. Grass tops is where you engage influential community leaders.
Correct.
So that's basically the difference if you had to separate the two out. And as for our audience. But Joe, what lessons have you learned from working with policymakers on healthcare issues? I mean, for example, this issue or others that you can think of. Is there something unique about that?
So I think that the wheels of government move incredibly slow, which can be so frustrating to people. But I think that ultimately people will side with the leaders and companies who are trying to do some type of an action. I think it's fundamental to people's core that they prefer action to inaction, which can oftentimes lead to really, really good outcomes. But, you know, sometimes it leads to, you know, it can lead to some not so good outcomes because, you know, to my first point, if the wheels of government are moving slowly, they're purposefully designed that way to do their due diligence. So to go and act quickly can sometimes lead to not the best outcome or something that is less impactful than otherwise could be. I think probably the other big lesson that I've learned is I want to phrase this the right way. The best way to build a coalition is to treat people with dignity. And a big part of that is listening way more than talking.
That's great.
Good point.
That's
important in local politics as well. Yeah.
Yeah. No, I really like that. So let's jump to the future of healthcare advocacy. Let's jump to trends and predictions. Where do you see healthcare advocacy going over the next few years? And what is it pointing to? Is it pointing to telehealth, telemedicine, mental health, addiction? What areas do you think are on the radar?
Healthcare economics. I think that is probably first and foremost. So I'm 37 years old. I graduated college, undergrad in 2009. You've got a cohort of people who have basically gone through several economic crises, for lack of a better term. And basically at 37 years old, people who were 37 10 years ago, 20 years ago, 30 years ago, were given a different set of opportunities or a different set of circumstances. What we're seeing now is basically like a reframing of the argument here. And I think that you've got folks, I don't think that's happening. I think you're seeing people go and maintain a certain like economic liberalism, which typically doesn't happen to people as they age. So I think, when you look at issues like, cutting the cost of drugs, possibly a public option, possibly like an exchange on the state level to go to a single payer type of program. Those are things that are going to be discussed, because I think at the end of the day, folks are paying more money than what they're making. And this is not just exclusive to healthcare. It's exclusive to housing, education, childcare costs, sort of the whole deal. And I think that, we're, quickly going and approaching a situation where all options have to be on the table. Like, I really do believe that at some point over the next decade, there is going to be a very serious conversation about there being a public option in this country. Whether that is good or bad, there's a whole other podcast show that we should do about that. But I think that certainly is a conversation that will happen.
Joe, I think that's brilliant. I do think that that's in the works. I also see technology and things that are invisible to us right now that will surface that could change that notion, though. And I do think artificial intelligence, there's a lot of hype around artificial intelligence. People think it's a bubble, but I do think that technology has the potential to alter your belief or your statement just now. And if that does what I think it will do, where it'll allow medicine to be done in the home, you won't be required to come to the office or go to the hospital for a lot of stuff. And it'll be so good at assessments, diagnoses, and treatment plans that it won't replace us exactly, but it'll raise the game, and it'll get rid of a lot of sort of mid-level folks that don't have a fund of knowledge as deep as folks who have done really hard training like John and I.
Now, will that bring the cost down, you think?
I do think it'll bring the cost down. It's a commodity. It's a supply and demand curve. Remember at the Kennedy School, they made us do quantitative analysis. So that stuff comes into play. Go ahead, John.
Yeah.
Yeah, there's a few different things that you already see now in private business, including mine, where health insurance companies now are giving the option to a big business to add telemedicine at a very, very small cost for all their employees. And then what they do is they encourage the employees to take advantage of that as opposed to going to see a doctor. So I could see the future being another level of artificial intelligence where there's going to be some form of artificial intelligence being offered for people who have aches or pains or issues, and they can go into some type of format where instead of having to go to a doctor's office and pay and have a deductible or a copay, this will be copay free or lower deductible. So they can encourage patients to do that. Now, I don't think that's all good, but I think it's a necessary evil, unfortunately. It's getting cost prohibitive. And like you said, there's not enough primary care doctors. Already many plans and many health organizations, what they're trying to do is they're calling their staff healthcare providers. Whether you're a doctor, a physician's assistant, a nurse practitioner, you're a healthcare provider, because they want people to get used to seeing somebody that's not a doctor. And that also theoretically will lower the cost, but will also increase access to those people. I just, the obvious fear is someone that spent so many years training and so much years of experience, you don't want it to affect the quality of healthcare.
Right. So I've seen
initially, it has to, but I think there's always going to be a period where less experienced people are taking care of people, but then those people gain experience.
But you'll augment that, John. You'll have a backup. You'll have a super genius behind over your shoulder. Albert Einstein will be over your shoulder, just, making sure that what you say is okay, it's kosher,
Yeah.
And I
The
think
whole-
it'll change the urgent care landscape and the emergency room landscape. I think you'll reduce the volume, but that economic model, yeah, it could play out. And it's not going to be too far into the future. But Joe, you were thinking of something?
I just
Look,
wanted to say one more thing. One of the unfortunate things I've seen, Joe, you said you're 37, correct?
Yes.
So I'm seeing a definite pattern among my patients nowadays where older patients are not used to paying for anything. They grew up in a system that was essentially free for medical care. And they still pretty much, I mean, they're in Medicare age. Sure, they're paying more than they've ever paid, but they're still paying relatively low amount of money for amazing healthcare. Whereas people in their 30s or younger, they're kind of used to, I have a high deductible. I'm only going to go to the doctor when I really need to. But also, they are used to when they go to the doctor paying. And then
Yep.
so it's really changed a lot in that 20-year span.
Right. And look, that's why I think, if, the route out of this is to do what you just outlined through AI, or it's through a single payer, public option, I think you've got an entire generation who's only getting older, who's basically open to putting all the options on the table. Because, there's this pinch, right? Right. And just to speak from my own experience, as an example, I pay more for part-time daycare for my two kids than I do for my mortgage. So I think that there is a willingness, and I think similar to, right, I think similar to healthcare.
Yeah.
These folks who are daycare workers, similar to doctors, like they're not making exponentially more than they were 5, 6 years ago. Just the cost of doing business is through the roof. And I think you've got I think you have like you think you have a public who is feeling the push from all sides. And look, our campaigns ratchet up the rhetoric every 2 years to the point where like there's no meaningful dialogue. In a way, like, look, everything you outline with AI, that very well could be the answer. But if the squad goes and brings it to Congress, well, then the folks in the Freedom Caucus are going to say hell no, and vice versa. And then you're left in a situation where, like, wait, guys, there are a lot of good ideas that are being dismissed solely by like the letter after that person's name, right? Which is incredible. I went to a thing at the Ted Kennedy's Institute for the Senate, where Sheldon Whitehouse and Senator Cassidy out of Louisiana spoke on a myriad of issues. Senator Cassidy is a gastroenterologist, and they talked about healthcare. It was really amazing to see two members of the U.S. Senate have an honest debate and discussion about the way to go forward on this. The rhetoric is so high and it's so hot out there that it's like that old, an adage of like you can't see your reflection in boiling water. That is where we are right now, right?
I can already see the ads on both sides. I mean, you're not going to get to see a doctor. You're going to get to see a computer, or you're going to lose your access to your doctor, or that's the way they're going to win a campaign. And I mean, unfortunately, now I see the same thing with the federal budget. I mean, the deficit. Nobody wants to even talk about it because they know if they do, the other side's going to say, look what they're taking away from you. So just don't talk about it.
To your point about like young people who were willing to pay stuff, that's why like the notion of like, okay, we're going to do a national tax and everyone's going to have national, Medicare for everybody, right? I understand it is extremely complex and there are a lot of issues with it. But on the surface, that's something, to your point, people are used to paying through the nose for it anyways. Why not pay them, right? Like if I pay through the nose for it anyways, and it's not tethered to my job, well then, hey, you know what? I win. Because now I don't have to stay in a dumpy job for health insurance because I'm just going to pay taxes and I'm going to get it. So it's this really weird situation where then we're like arguing the merits of a different argument than what actually should be the one that we're talking about, where it's, how can we bring costs down while keeping quality high? And I do think too, like to your point of people that are so used to paying for stuff, it isn't even so much on keeping costs down. I think it's stopping them from going up at such a quick rate.
Yeah.
But so I think there could be a really honest conversation about it with a lot of really smart people with a bunch of solutions. Like I said, 60 years from the time we learned to fly to put somebody on the moon, there is no way in this country that we cannot solve this.
Right.
I'll be Pollyanna.
Yeah, right. You put enough smart people together and things can get done. So that's really interesting. So this has been great. And Joe, Joe's 37. You know, I'm 107, so I'm a lot older. And I never told you that, John.
Great for
but I am.
107.
I look good though. I feel good. You know, I stretch. So, listen, Joe, thank you so much. Former HKS classmate. I'm thrilled to have him here. This was a great discussion. Joe, I'm going to invite you back. And John, anything before we wind up?
No, I'll ask Joe some questions after.
Okay, all right.
Some interesting questions.
All right. But fantastic stuff. Very interesting day. Biden dropped out, endorsed Kamala, and we will see what happens. We'll see what happens with the healthcare front. But really, thank you, everyone. Please like and subscribe, and we will see you on the next video. So long.
Thank you.